So at Terrence Higgins Trust, our mission is to, number one, end new cases of HIV in the UK by 2030. And our goal is to be here until the last person living with HIV needs us.
Terrence Higgins Trust is one of the UK's leading charities who really got behind the HIV Action Plan. The HIV Action Plan is all about diagnosing people who don't know they have HIV and getting them onto treatment, in that way achieving the 2030 targets of zero new transmissions of HIV, zero preventable HIV deaths. And so Terrence Higgins Garden tells that story of getting to zero, of people not dying from AIDS-defining illnesses or passing it on to their loved ones or their partners.
It was really amazing to be there at Chelsea and see the beautiful design that Matt and his team came up with. But I would say that it's even more inspiring to be here at Croydon University Hospital to see where the garden is going to have its forever home. Because this is a place where people who are living with HIV might be able to come and visit as they go to the clinic. The clinicians and the nurses and the doctors who work with those patients can come, and we've seen a couple of people come by on their lunch break to enjoy the garden and just take a kind of moment of peace and reflection in a busy day. And that's been really, really inspiring to see, and to see that garden live on, and for the hospital to take on ownership of the garden. It's really beautiful.
When we approached the design of the Legacy Garden, we were really, really clear that we wanted this garden to really work for the space and for the people that were going to use it. So rather than trying to recreate a Chelsea garden here, a show garden, we wanted to take the key elements from our show garden, the plants, the materials, some of the features, and create a new space that actually worked here in this location. So you will see lots of elements in terms of slate, Welsh slate that was a really key component, boulders, you'll see pines, you'll see birch trees, but they are all laid out in a very, very different way to the Chelsea garden. They are now their own garden, their own space, which has its own life of its own and its own purpose.
The patients are proud of having this garden. You know, I talk to my patients and they're like, hey, what's going on outside? There's this like beautiful garden. And I'm like, well, it's all about, you know, the team in the emergency department doing HIV testing. And, you know, it's a thank you really, I hope, from Terrence Higgins Trust, a recognition of all of the work that people do in the emergency department, in the laboratory, in the IT teams, and the trust supporting this program. I mean, that makes me really happy. I mean, you know, talking to my patients, you know, of going from a place where Croydon had the highest rate of late diagnosis in London and really high rates of AIDS-defining illnesses, to now us sort of doing so much testing, preventing ill health and transmissions, but also having a beautiful garden right next to our clinic for our staff, for our patients to walk through, have their lunch, have a coffee, have a chat. Yeah, it means a lot.
The garden at Chelsea achieved lots of the objectives that Terrence Higgins Trust were hoping to achieve. For me personally, one of the greatest things I saw was I saw people that were living with HIV at the garden feeling like finally there was a platform, somewhere where they can be themselves, that they could talk about living with HIV, a platform that made them feel proud, a mainstream platform, and it was really achieving all of these objectives that we wanted it to, which is to break down stigma around HIV, and that for me was the garden's greatest achievement. I'm so excited to come back to Croydon year after year and see how these trees behind me grow and develop, how the site changes, how we get more sense of enclosure, how the plants grow and develop and it settles in, and to see more and more people using the space. So I'm just really happy to see how this garden takes on a life of its own and lasts for years and years to come.